everyone, and welcome back to our final concluding session for this symposium. I would now like to introduce Dr. Maria Neira. We are honored to be joined by her today. She is the Director of the Environment, Climate Change, and Public Health Department of the World Health Organization here in Geneva, Switzerland, and she is a renowned champion in environmental health and climate change. So we're very pleased to have her perspectives on the discussions that we've had this week and how it fits into the work of the WHO. So Maria, the floor is yours.
Thank you very much, Joy, and thank you all for inviting me. I cannot turn my camera on because it says that, okay, now I can. They allow me now, the host allow me now to show my face. Thank you so much, and a great pleasure to be with you today. I've been following some of the discussions and I am really impressed. First of all, I'm impressed because of the interdisciplinarity. It was fascinating to hear the background of some of the participants with the different disciplines. One of the names that I really will remember is an atmospheric chemistry specialist. So I thought it was fantastic to have this incredible interdisciplinarity presented at the meeting. It's really a privilege. And in WHO, we certainly value that very much. The COVID-19 has showed that we need this type of interdisciplinarity, that there are very little barriers. We have been working with engineers, environmentalists, media people, all type of scientists, experts on communication, and of course, we still need more. So this interdisciplinary is fundamental, and for us, definitely something that we need to cultivate and create a very strong network on that. I would like as well to encourage you as environmentalists in the general field to keep with the research. As you know, only 6 months have passed since the day WHO has declared COVID-19 as a public health crisis of international concern. And it's incredible the number of papers that have been published in these 6 months. Most of them still to be peer-reviewed, maybe not following the procedures that we normally follow in the scientific community, but it proves that the amount of and the incredible number of requests and the questions we need to answer. Not all of the answers are at the same level of importance on stopping the transmission and responding to the outbreak, but all of them, all of this research is fundamental. Most of the questions were very much related to your field of knowledge. As you know, one of the critical questions that all journalists, media, and policymakers, they have been asking us from the beginning, is this seasonal? Is this linked to the meteorological and weather conditions? And of course, even when we don't have a response, we need to keep responding it. And providing the best of our advice regarding the knowledge that is available. Another critical question has been as well related to how this feel with the air pollution and exposure to air pollution. And although we still need to do much more research, and some papers have been published, but of course, not all of them at the same level of quality, or at least where we need to go deeper on the research. But one thing is clear: if you are exposed to air pollution, your lungs, your respiratory system, your lower respiratory system will be definitely much more vulnerable to any virus or any other attack where your lungs are fundamental to respond. So, which takes me to the fact that this environmental science is still very much needed, hopefully on an environment where we can provide our research in better conditions and not under the stress and the pressure that we are at the moment. But responding that we know that no matter what, if you tackle the causes of air pollution, you will be contributing to the 7 million to the reduction of the 7 million premature deaths that are occurring every year. And this takes me to the last point I would like to share with you, which is a little bit where we are now and what can we expect in the next months in terms of the crisis we are facing, which is not only a health crisis, it's a health and economic and a huge social crisis, as you all well know, and I'm sure that at your country level you are already suffering or at least detecting and noticing the effects of all of that. This is an exceptional situation, and of course, an exceptional situation will require exceptional solutions as well. We need to make sure that we will be contributing not only to the recovery from the COVID-19, but as well to put the basis for not being exposed again, not being in the future as vulnerable as we have been until now. And this is where we have already certain things that we can propose without taking the risk of making mistakes. One is the need for science, for all type of science, for all type of scientists like you, keeping contributing and doing research. That's for sure always a very, very good investment that we will never regret. Second, we need to make sure that now that some countries are putting some stimulus packages, some financial resources for this economic recovery, they will not make the same mistakes that we all did before, which means destroying the environment and not investing enough on a healthy and sustainable development. We need to make sure that we will stop certain, fossil fuels, for instance. We need to move into more sustainable and cleaner sources of energy, more renewables, and I'm sure that on that we are all in agreement. We need to create a system of preparedness, and this is where, again, it's a very good investment if the networks and the capacity at the country level to predict, to prevent all of those crises is in place. So your services before the crisis are extremely important to be better prepared. What the world will like to hear now, and the citizens and the society particularly, is that our vulnerability will be reduced. And the best way to reduce this vulnerability is by building on blocks related to a more greener and sustainable and development, the way we consume, the way we produce, the way we recycle, the way we invest on science, the way we treat our scientists, the way we build our cities, and the way we use our funds. We are still paying subsidies to fossil fuels, knowing that those fossil fuels are literally and killing us. So we need to be, as I say, at the exceptional times, exceptional solutions. We need to be more strategic. We need to take advantage of our role to influence policymakers without being shy. We need to influence our policymakers to take the right decisions. And I think we can propose many of them by being together and by making this type of networks very, very strong. Climate change is not a separate agenda. It's at the causes of what we are facing today. If we keep the relationship we have with the biodiversity and with nature at the moment, with our environment, of course, we will be very well prepared for any other crisis, any other pandemic, because in fact, most of those infectious agents are coming from the interaction between animal health and human health, under environmental, very stressful situations. So unless we correct that, we are not putting the basis for a more healthier society. So I count on all of you to contribute to this, what WHO called the manifesto for a healthy and green recovery, which are only common sense interventions, if I can say, and to keep this network, to keep this collaboration, and keep positive on the messages you are giving to your societies, influencing those decisions, and hopefully having a very positive impact. Thank you very much for this opportunity. Over to you, Joy. Thank you.
Thank you very much, Maria, for being with us today. You're absolutely right. Despite the multiple levels of crisis we're experiencing, this really is a pivotal opportunity to rethink our policies and how we do things. So again, thanks to the World Health Organization and for you being with us today. I'd now like to pass to Neville and Ben as we're going to share with you some of the outcomes from the event this week and what are the next steps that you can expect. So Neville, over to you.
Joy, will you be sharing your screen?
Yes, I will.
Thank you. So what I will do now is I'm going to go through the set of slides we've prepared in consultation with the committee, which has taken into account the contributions and the questions and answers and inputs we've received from delegates and from the posters. And this is broken up into 3 parts, which we will share among us. And I will be reading from some of the context part, and then we'll go into some of the content, which you will, you'll hear about more of. Just to emphasize that this is really a summary of a much more substantial statement, which we will be preparing once we've completed the consultations over the next few days. So just to provide context for this statement and for the meeting in general, we know that since other human coronaviruses and many other infectious respiratory diseases possess seasonal prevalence peaks, it is likely that should SARS-CoV-2 persist, it will manifest in a similar epidemiological pattern. This may, along with other factors, determine whether resurgences of the disease will occur and whether this will occur in different localities in different time periods around the globe. This requires consistent and transparent data collection, analysis, and assessment in order to facilitate replicability of studies and determine the appropriate science-based policy recommendations. Very importantly is that COVID-19 pandemic, this pandemic has provided us with an opportunity to bring together climate and health communities to create a more cohesive response in general to climate-sensitive diseases. Some observations on the science process, which I'm going to talk about briefly. I need to go back 1 slide. Yep, thank you. So it is remarkable, in fact, how the scientific community, and it's commendable how the scientific community has mobilized from a very wide range of different research disciplines. And this is in response to the need for rapid communication of findings which can accelerate the research progress. However, pre-reviewed postings and rapidly published studies on COVID-19 are vulnerable to circulation of non-reliable and non-trustworthy data and inappropriate statistical methods, and thus are open and vulnerable to misinterpretation and the misuse of results. And so that's something which we are very concerned about. Environmentally informed analyses and forecasts of SARS-CoV-2 virus and the disease COVID-19 must be accompanied with prominent and balanced summaries for policymakers and the public, and actionable research in this field depends on interdisciplinary and transdisciplinary collaboration. Right, I think I am going to pass now over to Ben Zaitchik, who will talk a bit more about the content, some of the content that we have agreed on.
Great, thank you, Neville. So just a rapid fire review of what we've learned, which again will be fleshed out in a more robust way in a meeting summary. So day 1, as you'll recall, was really focused on understanding these linkages that are our focus. And some interim conclusions that we have is that there is not yet a demonstration of a consistent and strong meteorological influence on COVID-19 transmission or burden. Now, that's not to say that there isn't a meteorological influence and that studies aren't finding in different regions using different methods evidence of emerging sensitivities. But at this point, we can't make a statement that says, this is what temperature or this is what humidity does to COVID-19 transmission. That's still work in progress. The evidence on air quality is perhaps a little more mature, particularly when it comes to aerosols and the roles of that, both in the transmission of the disease and the severity of its impacts. And so that's something that's a very important area of collaboration between the meteorological and environmental communities and the health communities going forward. Also wanted to emphasize a point that came out on day one regarding how this pandemic started, right? And the spillover from the animal to the human host, and the lessons that we should draw from that on human environment interactions. And I really appreciate Maria's remarks just before this, again, bringing us back to perhaps this broader context, right? Of understanding our role, not just in the very important work of understanding and forecasting environmental impacts on this disease as it emerges, but also thinking more broadly and communicating more broadly about how this falls in the context of how humans interact with their planet, and that this is all part of a broader perspective on how we operate as a society. There are challenges and prospects with that understanding. The challenges are myriad. I don't have time to go through all of them, but of course the health data, particularly the case data, reliability, consistency, interpretation of this in this early stage of the pandemic is a huge challenge. The environmental data are often in better shape than the health data. We need to work with those data and collaborate in an informed way. Deviations in methods, how to deal with confounders, I'm calling them, but variables, everything from demographics and comorbidities through lockdowns, policy, social response, huge challenge for us. Understanding the mechanism, of course, is at the heart of this, and also local heterogeneity, how the environment can operate differently in different places. That said, there is great potential for this line of research moving forward, particularly as the pandemic moves into later stages. And it might, if it becomes endemic, for example, with a phase lock, but even before that, as we get through a full seasonal cycle. That there is a real opportunity and need for knowledge gathering through systematic review. Now, on day two, we talked more specifically about predictability and forecasts, and our interim conclusions there include the fact that there are ongoing efforts, and again, the energy of the international research community is to be applauded. And yet, I think that we all agree that the initial efforts at forecasts are limited by a lack of the availability of robust evaluation data, of mechanistic understanding, and that therefore extreme caution is really to be advised to any policymaker or policy action that's being informed by an environmentally driven COVID forecast at this time. And that we really need to also provide evidence as we move towards more mature risk analysis and early warning systems to put that in the broader context of the environmental and climatic sensitivities of the disease, as we've learned from other diseases. You really want to provide that information, not just a risk projection out of context. So challenges here, of course, similar to day one challenges of verification data, the short data record, the multiple other drivers going on in the early pandemic stage. But the prospects here is that both because the data record is getting longer and because there is some likelihood that the environmental factors might become a little more predominant as we move past the first stages of the pandemic, this kind of effort is going to become increasingly important. It was also noted that there's a strong relevance to environment when we talk about vaccine strategy. And so that's something that we're going to want to perhaps key in on as a community as different kinds of therapeutics and vaccines come out. And finally, that multiple hazards are an issue here. So beyond just forecasting COVID, thinking about how other diseases that are environmentally sensitive are interacting with the COVID risk, as well as extreme events, climatic events that then pose risk need to be addressed. Finally, today, we really turn to communication and actionable information, and emphasize the fact that users have different needs, and that we really need to focus on having confidence in the product that we're producing for different users. We need to move at the speed of relevance, as was stated, but at the same time, providing good guidance on how to utilize these kind of pre-review or single study results that may not yet be fully robust. Challenges here is how do you communicate usefully under deep uncertainty? How do you communicate across chains when you might be like training the trainer who's then communicating for you? And the fact that different end users need different information, but that's also an opportunity, right? To take advantage of diverse communication strategies, emphasizing the need for transdisciplinary collaboration and coordination. And coordination meaning both across fields and as a community as we try to assess knowledge at a regional and global scale. So that was as quickly as I could go through the rich data that and information we've received, which we're trying to distill into some findings. And first and foremost here, the need for sustained engagement with decision makers. I think that's critical if we're going to contribute usefully. Secondly, just to reiterate that though it seems quite likely based on other coronaviruses and similar viruses that there's going to be evidence that there will be a meteorological influence, more research is needed to better understand which meteorological variables are having which effects, and that could be regionally and specific to pandemic stage. Seasonal cycles similarly might manifest later. Right now, it might already be operating, we don't know. We can't separate that seasonality from all the moving parts that have happened in the first few months of this pandemic. That will probably become clear in the next months and perhaps over the next year. We really need to understand mechanism. That's obviously a grand challenge for us in research, and that needs to include sensitivities of the virus to environment, but also sensitivities of the human response to the virus, sensitivities of our social behavior, and also how indoor and outdoor conditions interact. And then levels of confidence and certainty need to be carefully described to ensure appropriate use. I think that's good practice always, and particularly in an urgent situation like this. And finally, if we're really going to effectively use climate, meteorological, and environmental factors to inform control measures, we need this transdisciplinary collaboration across the value chain. And so I'll hand over to Joy for to distill some key outcomes.
Excellent. Thank you very much, Ben. So just in closing very quickly here, I think the big picture is that we always need to study the environmental and meteorological influence on disease in a full epidemiological context. And that when it comes to early warning systems, we need to be very confident that we understand these signals before we are using this information and suggesting it to our decision makers, confidently communicating the predictability and uncertainties around environmental prediction. And that finally, this week has really demonstrated how important having a culture of open data and open science is, the interdisciplinary nature, not only of research teams, but the data collection and sharing is really needed now more than ever. And finally, that we need to be translating and communicating this science very clearly and carefully to make sure that it's appropriately used and making its maximum benefit. So just moving forward and what you can expect in the coming months and years from this community and conversation we've had this week. First and foremost, there will be a summary report and formal outcome statement which builds upon some of the preliminary reflections that you've heard today. We hope to get that up as soon as next week. And there will be a communication going out to all the registered participants for the symposium, which will give you all of the relevant links for the various things I'm about to mention. We also feel it's really important that everybody stays connected. This is just the beginning of a process, and we know that this research needs to continue, it needs to build up, and we've been very pleased to see everybody come together this week. So we will continue to support the Connect community that we've been using during this conference. You'll also have options for how to opt out of that, but we do want to make a platform available for people to share and continue discussing. We'll also be putting up some new web pages at WMO where we can share, again, resources, new findings, and new information. Also discussed the last few days, there will be a special issue of One Health, thanks to Elsevier Publishers, who are making this available free of charge for those that have presented in the symposium. Again, the deadline for submitting manuscripts to that peer review process is going to be September 23rd. So please do consider submitting your manuscripts to that special issue. Next, there has been a task team established at the World Meteorological Organization under the Research Board, who will be taking forward the findings of this week and considering in a more structured review process what the state of the science is, helping orient us to the needs in research priorities as well as data and helping make some authoritative statements over the next year and a half on this topic. So fortunately, many of the experts who participated this week are also involved in that process for some continuity. And then finally, we really encourage everybody to continue collaborating. So please, find the regional discussions that may be happening in your area. Keep building collaborative partnerships for this research. It is really important that it continues and that we're all coming together as an interdisciplinary community to solve this problem. So, and in closing, I would again just like to thank our science committee who have come together tirelessly in the last 2 months to be able to make this a timely and relevant conversation for us all. This has been a great experience working with everybody and pretty remarkable that we've managed to come together in a little over 2 months' time. So again, thanks to all of our partners and particularly to the logistics team at AGU that has made this entire online symposium possible. I think we've had over 400 participants every day engaging in the conference, and that's just been a fantastic opportunity that, again, maybe we wouldn't have had the opportunity to engage so widely around the world if we had done this in person. So again, taking advantage of some of the opportunities of our new virtual world. And finally, I would just like to thank all of you for coming together, for sharing your research, for wanting to bring your knowledge and expertise to address this really complicated global challenge. We have absolutely been inspired and impressed by the very skillful research teams who have come and shared with us this week. So I very much wish everyone to stay healthy and the best of luck in your continued research and your operational roles, because we do all have a role to play in solving this complex issue and research questions that we've been discussing this week. So again, thanks to everyone for joining, and we look forward to staying in touch and continuing collaborating with you all. Thank you all. Bye-bye.
Yeah, really, it's a terrific 3 days.